Assalamu alaikum dear students, hope you all are well. Today we are going to start water accumulation, what happens when excess water intake, water needs. Before we start, I would like to recall that in our previous lecture we have discussed the function of water, role of water, dehydration. So today we will discuss these topics. Food enters in stomach, gastric juices is secreted when it is enters in small intestine, then pancreatic juices is secreted. Each of these fluids contain water. In a day, there is an exchange of about 10 liters of water among the body organs. The osmoregulation of this exchange involve complex communication between the brain, kidney, endocrine system. A homeostatic goal for a cell, tissue, organ system is to balance water output with water input. We already discussed about the homeostasis. Water in foods, beverages, and liquids foods like soups, broth provided greatest amount of water. Water is also found in fruits, vegetables, 75 to 95% of water. Other sources like between 50 to 75% of water in chicken or foods less than 35% of water is provided like honey, jam, crackers, and vegetables. Oil is typically contain no water. Fizzy drinks that provided the energy. In addition to supplying water, beverages like energy drinks, soft drinks, fizzy drinks, they are very popular. They provided more calories, like about 13 to 22% of total calories. Nutritionists are concerned about increasing the intake of beverages because they provided the little satiety, and satiety means the feeling of the fullness. We do not compensate for the calories we drink by eating less food to prevent weight gain. The calorie content of the beverages should be considered in the diet planning. Soft drinks contain few macronutrients when it is compared with the milk or other fruit juices, and when soft drinks are selected over the milk, then vitamin D, calcium, phosphorus intake drop, and similarly, when replacing fruit juices with the beverages decreases the vitamin A, C, or folate intake. Although some beverages and water are fortified with certain vitamin minerals, but they do not contain all of the minerals. Um, both coffee and tea are the popular beverages, and some website magazines shows that caffeinated beverages basically work as a diuretic and increases the urine output. So water needs depend upon different factors such as the body size, physical activity, environmental factors, dietary intake, For male, intake of total water intake per day is 15 cup or 3.7 liter, and for female 11 cups or 2.7 liter for adult women. And this amount include water from liquids like 80% and from food about 20%. Fluids are water provided by food and beverages we consume. Water is generated during metabolism, oxidation of carbs, protein, fat produce water. Water produced from metabolism is 1 to 1.5 cup or 250 to 350 ml per day. Excess water accumulation. Drinking too much water can be dangerous as consuming too little. Drinking too much water can cause water intoxication. When this occurs, then concentration of electrolytes, especially sodium, in the blood is diluted. Low sodium is known as a hyponatremia. Hyponatremia is basically low sodium concentration in blood. Then the level of sodium is less than 135 mmol. In severe hyponatremia, the level is below 120. Symptoms include decrease in headache, nausea, poor balance. Excess water consumption mainly affects the athletes who overhydrated or infants under age of 6 when provided extra bottles of water or over diluted formulas. In healthy kidneys, they are capable of excreting up to 1 liter of excess water per hour. Water accumulation or excess intake of the water is occur in some diseases. Infection, cancer, kidney issue can causes the water retention because sodium is not being excreted. Normally, fluids and sodium then restricted. Excess water drinking is one of the characteristic of schizophrenia. In case of the acute psychological stress that lead to excessive water intake and that resulted in brain damage. So, without a medical or psychological issue, how is overhydration treated? Reduce fluid intake, taking diuretics that increases the amount of urine, and treating the any disease that causes the overhydration, stopping any medication that causes this problem, and replacing the sodium in severe cases.
There is a time in every person's life when drinking water is deadly. Even as much as a few ounces is enough to kill. The average healthy adult is made up of 55 to 60% water. The average baby, on the other hand, is roughly 75% water. And that difference is why babies shouldn't drink water before they're at least 6 months old. Not from the tap, or a well, or a spring. Plain water is just plain off limits. You see, everyone's kidneys have a limit to how much water they can handle. Break that limit, and the excess water will back up into your bloodstream, where it dilutes the salt, or sodium, in your blood. Once your blood dips below 0.4 ounces of sodium per gallon, you're at risk of a condition called hyponatremia. It happens when your cells try to return sodium levels to normal by absorbing the extra water, and swell up like a water balloon in the process, causing complications like confusion, vomiting, and muscle spasms. Hyponatremia is common in marathon runners who drink too much too fast during a race without also providing enough sodium to balance out their blood. And if you keep drinking, that excess water will eventually reach the cells in your brain. By this point, you have a dangerous case of water intoxication, which affects roughly 200,000 Americans each year. It occurs when your brain cells swell, which builds up pressure inside your skull that can lead to seizures, brain damage, and in severe cases, death. But don't worry, dying from water intoxication is extremely hard for a fully grown human. An adult would have to drink 2.5 to 5 gallons every few hours to reach that point. But for newborns, it's a different story. Their kidneys are about half the size of an adult's, so they can't hold much water to begin with, and it takes just a few ounces to cause problems. On top of that, their kidneys aren't developed enough yet to properly filter water, so any water that enters their body ends up in the circulatory system, where it dilutes their blood and increases their water content by 7 to 8%. But it's not just drinking straight H2O that poses a threat. In fact, most cases of water intoxication in infants don't even involve a glass of water. A common mistake is when people dilute baby formula too much by accident, or when parents dunk their infants up and down in a swimming pool, and in the process the infant gulps in too much water. It's important that if your baby is showing signs of water intoxication, that you take them to the hospital immediately, where a doctor will likely provide some form of fluids, like intravenous saline solution, to bring the infant's sodium levels up to normal.